Breast implants have several variable factors that allow patients to customize the look and feel of their augmentation based on their aesthetic goals. First is volume. Here you can see implants that range from 300 to 450 cc's in size. This is how we control moving up in cup size of the breast. Projection refers to how far forward the implant sticks out off the chest relative to its volume. Here we have low, moderate, and high projecting implants, all of the same cc's in volume. Notice how the low projection is the most wide and the high projection is the most narrow. Next, let's talk about fill and cohesivity. The more full and cohesive, like the silicone implant on the left, the more firmness and upper pole cleavage in the result. There is also less chance of rippling seen through the skin, although the chance of this is low with silicone implants in general. Another variable is fill substance. This is a saline implant. Here is the tab that allows us to fill this silicone shell with saline fluid after it has been placed inside of the patient. This allows us to use an even smaller incision. However, some downsides are that if the shell ruptures, the patient will be noticeably flatter on one side. Also, the feel is not as bioidentical as a silicone gel implant. The last variables are texture and shape. Textured implants are rarely used in the United States. However, they do serve a role in patients who suffer from repeat episodes of a complication called capsular contracture. The surface material helps decrease the risk of a repeat deformity. The shape of this textured implant is referred to as an anatomic teardrop implant. This is meant to mimic the natural shape of the breast, where the majority of the volume hangs at the inferior pole. However, when a smooth, round implant is held upright and placed into the breast pocket, especially under the muscle, it too takes on the natural anatomic shape of the breast. And there you have it, all the variables that a plastic surgeon and the patient must take into consideration when custom tailoring their approach to breast augmentation.